Let's put this together with a couple of case histories, and then we're going to have some time for some questions and answers. It's not important that you read all the words in all of these slides. I'm going to hit the high points, but I do have over 60 case histories in my book of women of different ages and stages, so if you want to get that and read more detail, you're certainly able to do so. This patient comes in, she's 32. Well, that's too young to have a hormone issue, isn't it? No. All right, 32. She's got weight gain, joint pain. She has a diagnosis of psoriatic arthritis. She's been on Topamax, methotrexate, Remicade, stopped all of these because of side effects. She's been given an oral contraceptive because she has irregular menses. She's got fatigue, poor sleep quality, and worsening PMS. And of course, her physician had told her that she doesn't have any hormone problems. Okay, so she's taking past medical history. She's taking her contraceptive. She's had 2 pregnancies, 2 deliveries at age 19 and 22. She breastfed the babies. She's had her gallbladder out. She's had a tubal ligation, a family history of high blood pressure. She's got a high school education, lives with her husband, 2 kids, a dog and a fish, married 14 years, works as a secretary, watches about 3 hours of TV a day, volunteers about 8 hours a week, and does not exercise. She's eating a soccer mom diet, driving her kids around, drinking 4 or 5 sodas a day. She says, I'm too tired to exercise or cook. And you say, why do you ask all these questions? Well, I ask all these questions because they are relevant to the patient and her health. A study in the Journal of American Medical Association a couple of years ago talked about television watching in midlife women, and they followed a group of midlife women for 7 years. And they found that the single most important activity that predicted their development of insulin resistance, diabetes, and obesity was how much television they watched. And starting at 7 hours a week, there was a direct correlation with the development of those problems. Now, how does watching the TV affect your blood sugar? What do you do when you watch TV? Right. And what do we tend to eat? Comfort foods, right? Okay. So on her physical exam, she's obese. This is a measurement of obesity. Her blood pressure, she's pre-hypertensive according to the American Heart Association. The waist circumference, look at that, 41 inches. Definitely higher than we want her to be. Remember, it should be 35 inches or less. She's got an enlarged thyroid. She's got fibrocystic changes in her breast. Her hands and feet are cool. She's got the psoriasis, changes in her scalp hair. These are just mood scores that I do as far as depression and anxiety. On her lab imaging, her thyroid functions are abnormal, so she's got a thyroid problem. Her triglycerides are high. These are inflammatory factors that are high. Her blood sugar is high, and I know y'all have different numbers and reporting systems here, so it's not important that you see the numbers, just understand the concept here. And this is a measure of insulin resistance, so she's pre-diabetic, pre-hypertensive. Her vitamin D level is very, very low. Her vitamin B12 level is very low, and on pelvic ultrasound, she's got ovarian cysts. So am I going to stop there? No, we've got to do hormone profile, right, for a complete picture of this patient. So here's her hormone profile. Can y'all see this over here? Do you want me to pull the podium back, or you got it? Okay. Her estradiol is normal. Her progesterone is extremely low. This is very, very low for a 32-year-old. And then that ratio, remember the graph I showed you looking at the ratio, which is so important? The ratio is very low of her progesterone to estrogen. And then look at her androgens. They're too high. Her testosterone is high and her DHEAS is high. And then her cortisol, this is her stress hormone pattern. It's really not too bad. Starts out okay in the morning, drops, comes up a little bit in the evening and then down. But we see this elevation in the evening in women with children in the home. Because what are they doing at 4 or 5 in the afternoon? They're starting their second shift. We call it the double day. So they get up in the morning, they go to the office, they go to the school, they go to work, and then they get the kids and they start the cooking and the cleaning and the softball, soccer, voice, guitar, going to church, PTA meeting, getting dinner, pets, orthodontist, dentist, birthday presents, wedding gifts, baby shower. I mean, you know how that goes. And then, finally get to fall in bed. So this is where she's starting her second shift. Okay, so how am I going to treat this patient? Am I going to give her Prim Pro? Am I going to say stay on your birth control pills for this? Absolutely not. I'm going to give her the hormone that she needs, and that's progesterone. And then, of course, she needs thyroid support, she needs vitamin D, vitamin B12, and your compounding pharmacist can do all of this for you. And I talked with her about diet and lifestyle changes. One of the first lifestyle changes I'll do with the patient is have them get a pedometer. How many of y'all have a pedometer? Oh, that's wonderful. Well, I was at PharmaSave yesterday and I saw that they have the walking programs. And I will typically have my patients start with 4,500 steps a day. Now, that's not effective for weight loss, but that is effective for mood, according to the Cooper Institute. And then we're going to gradually increase that. But when she looks down at 6 o'clock at night and her pedometer says 1,700, she's got a long way to go before bedtime, right? And women can take advantage, so even when they're running their kids around, they can get out, walk around the parking lot, walk around the soccer field, instead of sitting in their car and talking on their cell phone or doing their nails. I mean, I know, but if you push yourself, you look at the pedometer, you're going to move more. You're going to take those opportunities, take the stairs at work, park further out in the parking lots when you're running your errands. And then I want her eating a Mediterranean diet. Eating this type of diet has been shown to be protective against cancer and against cardiovascular disease. And it's affordable, easy, and practical to eat this way. And I have resources in my book as it relates to websites for this, and you can also get this information from the pharmacist. Now, I am from Texas, which is the home of the National Cattlemen's Association. And red meat is up there at the top of the pyramid to be consumed very, very infrequently. I would say practically in Texas, if I get my patients to red meat 2 or 3 times a week, that's good. And that's what we do. Try to do bison, hormone-free, antibiotic-free bison for the red meat. I think is preferable. Okay, also, I may not get a woman to change for herself, but she will change for kids. I've never met a mother that doesn't want her kids to succeed academically, socially, emotionally, spiritually. And we have research studies showing that eating out 4 times a week will increase a child's cardiovascular disease risk. This was presented at American Heart a couple of years ago. They looked at 2nd graders, 4th graders, 5th graders, 8th graders, and 11th graders. They measured cholesterol factors, insulin factors, and they found that the kids that ate out 4 or more times a week already had biomarker changes putting them at risk. And eating out included eating school lunches, school breakfasts. The other factor that's important is eating at home at least 5 meals a week has been shown to be protective and conducive to self-esteem building, to better academic performance, to less substance use and abuse in teenagers. So I know that she's going to eat better if she eats at home. But how am I going to motivate her to do that? It's hard. I know it's hard. You got to have a crock pot, you got to have a bread machine, you got to have an ice chest, at least in East Texas where it's so hot, so that when the kids, I'm hungry, Mom, you just unzip it and you start throwing food back there. You got your carrot sticks, you got your bottled water, so you don't fall into that trap of having to pull into, a fast food place and eat something devoid of micronutrients. And I can't tell you how nice it is when you program your bread machine and your crock pot to walk in that door after a hard day at work and have those aromas and know that all you got to do is make the salad and set the table. And you can make your kids do that. Right, Brennan? Okay. This is another way of introducing positive relationships with food. Does anybody here have an arrow garden? You do. What are you growing? Everything. What are you growing? Okay. What are you growing? Tomatoes, great. So you don't even have to get all dirty and messy and deal with the birds and the squirrels and the rabbits. You can grow in your kitchen, on your countertop, on your desk at work. And I want the Pharmasave selling AeroGardens. Georgia, you need to make a note of that. Okay. I got the stainless steel model because this matches my kitchen. But the bio lights are up here, and here's your little seed pods, and it tells you when you have to water it. This is my 16-year-old daughter getting our garden started. And this is after 4 weeks. This is growing tomatoes and peppers. And it's just really delightful. And you can get the kids participating in this. This is great for the classroom, for teachers to be doing. Okay, so not only do I prescribe progesterone, but I also prescribe movies for my patients. A couple of years ago, I started prescribing films as an affordable, accessible, practical therapy to help my patients better understand their intimate relationships, beliefs, and interactions with the outer world. And so this is a movie that I worked on with Paramount Pictures called Leap of Faith with Steve Martin, Liam Neeson, Philip Seymour Hoffman, Deborah Winger. And if you catch me at lunch, I can tell you some movie stories. But I have a whole chapter in my book on cinema therapy if you're interested in some of my movie lists. So, I forgot, I don't have the movie, I guess it's in here somewhere. Well, the movie I recommended for this patient was Super Size Me, because I wanted her to understand that eating the fast food was severely detrimental. And another fast food movie is Fast Food Nation. Now, these are not movies for kids, okay? They're for the moms. I was speaking at a conference, and a few months later, a lady came up and she said, Dr. Stevens, I just want to talk to you about your movie prescriptions. She said, I rented that movie, and it had some very foul language in it and wasn't appropriate for my kids. And I said, no, these are for the grown-ups. These are educational tools for my patients. Okay. So she comes back. She's got some lifting of fatigue, improvement in sleep, decrease in joint pain. Her menses is every 32 to 38 days. No side effects. You can see her thyroid functions are looking better. Her blood sugar has come way down. Her insulin resistance has improved, and she's feeling better. Here she is at 12 months. Feels better, more energy, less pain. Her psoriasis improved now. We've got that waist circumference down to 37 inches, and her triglycerides are now 124, blood sugar now 95. I mean, these are fantastic results. This is without a statin. This is without metformin, glucophage, all that mess. This is progesterone, nutrition, lifestyle, getting her into a better level of health. So you can see here's her hormone profile. Estrogen is normal. Progesterone is in therapeutic range. We've got the ratio up. And by giving progesterone, we decrease those androgens, so her testosterone and DHEAS are now normal, and her cortisol rhythm looks good. Also, I prescribe yoga for my patients. I have a chapter in my book on yoga. We did a study on yoga for working women at our facility and published those results in 2004. This was just a once-a-week yoga intervention, and we saw significant results. I do yoga every day. But you can get results with just going to a class once a week. And many of the women in our study were overweight or obese or deconditioned. And I know it's kind of hard to see. We also used video instruction. We didn't even have a live instructor because university accused me of using a state facility for the practice of the Hindu religion when I wanted to do the study. So I had a battle there, but I won the battle and published the study. Okay, so you're going to hear a lot more about yoga and how it helps with heart and lung and musculoskeletal problems in women.